Hello, everybody. Recording live from somewhere.
Welcome to the Dental Efficiency Playbook. Here we go. Hey, party people. Welcome to the Dental Efficiency Playbook. My name's Gabe Hofmann, also known as the Dental Efficiency Guy. This is the show where you get insight, tips, tricks, and the occasional cheat code to level up the dental game. Tonight, our guest, Dr. Mark Doherty. Wow. I want to tell you a little story. Dr. Mark. So Mark and I met. Well, first I heard Mark when he was on a podcast with Sarah Ruberg, Boston and Bubbles, and I was laughing my butt off listening to you guys go back and forth. And I obviously know you guys have known each other forever. But then I was at Women in DSO and I saw Mark and I didn't know, how do I know this guy? He looks really familiar. And I've worked in endo for many, many years on the equipment side and then supporting endodontists. And so I walk up to Mark at Women in DSO and I introduce myself. He's talking to some mutual friends of ours. And after we jam for a little while, we figure it out. He's like, I have 4 endo practices. There are many other things that he does that I didn't know at that point. But then we start jiving and talking. I'm like, man, that podcast was so good. And you're like, well, we haven't been doing it for a little while. And I liked getting on podcasts. I'm like, well, I have one. So why don't we talk? And I don't know how many months later, here we are. But anyway, Mark, you do so many things. You got your mobile dental clinic, which I think is awesome. And I shared with you that for a number of years when I was outfitting those with equipment, with CBCTs and sometimes some other equipment for mobile dental clinics. But I believe you largely serve kids in your mobile dentistry as well, which is absolutely awesome. You have four endo clinics, so you're multi-office on the endo side. Obviously a podcaster. I know you do a number of other things. You are an avid Boston sports fan. I think I shared this with you, but I am New York through and through on the baseball side. So we got the episode tonight is South Boston and a Yankee talking shop. So here we go. Yeah, well, growing up, I might have called the Red Sox.
Oh, I bet you did.
They were the poop socks in my house, or maybe some other terms, right? So anyway, all kinds of wonderful terms. And they finally got that one championship after we had, 26?
100?
Yeah. So I have to rub that in a little bit. Of
course.
Anyway, great to see you again. We've been trying to get this, make this happen for a little while. So I'm glad to talk to you tonight.
Yeah. Thanks so much for having me, Gabe. And yes, meeting you at Women in DSO, it was great. Obviously, we clicked right away. You got such a great personality. We truly hit it off, and it was good discussions that we had. And thanks again for reaching out to me more recently to be a guest on your show. This is fantastic.
Sure. I'm glad we could do this. So tell me a little bit about, I don't have as much familiarity with it as you do, but I'd really like to learn more about the mobile dentistry. Obviously,
Sure.
You're treating kids, which is fantastic. I didn't realize prior that it was child focused, that you're going to schools.
No, thanks, Gabe. It's pretty cool. My late father actually started the business over 40 years ago.
Wow.
He was asked by the Massachusetts Department of Public Health if he would start treating youth in the Department of Youth Services, so basically kids in jail. And at the time, my father was a dentist at a public health dental center. And the outgoing guy that he was like, yeah, let me go. I'll start treating these kids. So he got a van from the public health, from the Department of Public Health. And he started going to these Department of Youth Services and started treating the kids. And soon word got out. And, places like Boston Public Schools started hearing about it, and they requested his services. And then over the years, it grew and grew. And, I would say I've been on board for over 15 years now, and, owner now, CEO. But it's funny because prior to the pandemic, we were really going along pretty well. We had about 7 or 8 dental teams, and basically a dental team is a dentist and an assistant. And we're a portable dental practice, so not mobile, not buses or vans, but our dentists have all of their equipment with them in their vehicles. They travel to the schools. They set up in, say, a nurse's office, treat the children for the day, the week, a couple of weeks, however long they have to be there, and then move on to another school or program or facility to treat patients. And mostly it's children that we treat under age 21. But it's, as things evolve, we have evolved. And now our services are getting requested by colleges, by employers in the area. But, we were really going along well before the pandemic. And then when the pandemic came in Massachusetts, schools were either closed or not letting people in for 2 years. So, the dentists that worked with us, they were like, we need to work. And so they had to move on. And so it was almost, the end of our portable dental practice. But luckily, we were able to hang on. We had a couple of our providers who have been with us for 20 years plus stay on and kept it going. And since then, we've been rebuilding, and we're getting back to the numbers where we want to be. But it's been a process, and it's not easy. But it is such a cool service. Because first off, it's a concierge service, right? We're providing the services to the patients. We're going to see them. And for the parents, it's great because now they don't have to take time off from work.
Of course,
they don't have to worry about, driving or transportation issues. And, it really works well for them. And, in Massachusetts, the school districts are pretty close. And a lot of our business is from word of mouth. It's from nurses, it's from principals, it's from superintendents who work with each other or network with each other and say, hey, have you tried Commonwealth Mobile Oral Health Services out yet for dental services for your school? And they'll be like, oh, no, what's that? And, next thing we know, we get a call. So, like I said, more recently, the past year or two, historically, we've been strictly underserved populations, patients who don't get dental care, Medicaid patients. But now, like, more affluent towns are reaching out to us. And still, we want to stay away from patients who have a dentist. We don't want to step on their toes, but we want to treat the kids who don't have a dentist. And, unfortunately, there's a large population still in the country that even if they have private insurance, they don't have a dentist. So, the need is there. And as long as the need is there, we try to accommodate that need as the best we can.
Wow. That's really cool. I'm glad to hear. It's actually really cool that, you're getting some universities and some other opportunities. But it makes sense. I'm curious. So are the schools hiring you? Is that like a contract, or are you being hired? Like, are there, patients that are interested, or in the case of kids, the parents are interested and they bring it to the school? Like, how's that normally happen?
Yeah, no, that's a great question. So we do have contracts with the cities, the schools, and we have a contract with the state of Massachusetts as well for the Department of Youth Services for where we treat. The parents, they have to fill out medical and consent forms prior to us providing care to the children. So we get all of that paperwork or digital work out so that the parents can fill it out before we go to the schools and or the programs and treat the patients.
Okay. Is that a nonprofit, or is it a for-profit business?
No, we are for profit.
Okay. So I would imagine, again, the Dental Efficiency Playbook, I'm kind of curious. You don't have all the overhead, right? So it's
Gabe,
wages, supplies,
so let's
travel.
go. Let's talk efficiency. And obviously I got the efficiency guy. So number one, vans, buses, hey, you're spending big bucks on that, hundreds of $1,000s on that. That's the first thing. that needs to get eliminated, right? Because with
Right.
the portable equipment, yes, it's not a large overhead. And know what? All of our staff, they work remotely from home now. So we no longer have a headquarters. We no longer have, that overhead, the rent and all that part of it. So it's really simplified things. And honestly, the expenses, it's a pretty good deal, especially in this day and age where dental inflation is just so darn high.
Well,
It's the
yeah,
opposite
I
in my
mean,
private practice for
I
endo.
think about increasing cost of fixed, right, of your assets, your fixed costs, and then likewise your variable expenses. And so if you can trim some of that fat, you're talking about a lot less your startup costs are much less.
Yeah, we
Um,
are always looking to go lean. How can we go more lean? How can we go more lean? That's
Interesting.
always at the forefront, just because it's so challenging. And with the majority of our patients being Medicaid patients, beneficiaries, reimbursement, is about 50 or 52% compared to what you'd see in a private practice. So, again, we have to be smart about it. But I would also say the reimbursement for Medicaid in Massachusetts is one of the best in the country, for children in
Okay.
Medicaid. So, again, you got to have the right things in place to kind of make it work.
Well, now has that changed somewhat when you talk about universities or more affluent areas that are calling you in because they are probably PPO or fee for service insurance, correct?
Right. So obviously now we're starting to see more of the private insurance patients,
So
and
you may
so
be able
which
to balance, right, make up for some of that.
make up for some. Yeah, yeah,
Yeah,
but
no.
it's
I get
still
there's a 20 to 30%, sometimes even
yes,
larger 40% difference depending upon the fees between Medicaid and PPO and type of PPO, I would say. But
right.
but yeah, on average, um, I can imagine and I understand there's a lot of practices in America that are trying to get away from Medicaid because of the challenge paying bills with the increasing cost of supplies, wages, everything else, right?
Right, and it's certainly an
So
uncertain time right now, with Medicaid, with Medicare, with the new administration, and
oh gosh, let's talk fluoride, right? So you're seeing
jeepers.
kids, some of these states. Now, I don't know if that's the case in Mass, but some of these states outlawing fluoride, which I know, especially in underserved populations, like fluoride hardening the nail. There's other things that can do it, but it's really important that they get that because they again are an underserved population.
Gabe, thanks for bringing that up because it's so important. And, just to spend a minute on it, you know, so as an endodontist, right, when I see a patient, it's usually the end of the life of the tooth. They usually have one or two options. Either they're saving the tooth and doing a root canal, or they're taking the tooth out, because if they don't, they're going to continue to have pain, swelling, all those things we like to avoid.
Yeah.
So I can see what happens at the end stage. But it's funny because, usually when I'm working on patients, I feel bad and I say to myself, my gosh, we have the materials, we have the knowledge, we have the research to support minimally invasive care, preventive care, and most of these patients shouldn't even be having to see me if they have a provider that practices that way, if they're compliant patients. And, fluoride certainly is one of those big factors that, leads to good oral health. And, now that we're talking where states are banning fluoride, where communities are no longer using fluoride or banning it as well, we're going to see some serious effects in the future. And in fact, not too long ago, I read an article, HPI, Health Policy Institute, American Dental Association. They predicted that in the U.S., in the next 5 years, we can expect to see dental costs for patients go up to $45 billion because of abandoning fluoride in our communities, in our states.
And where is it now? I should know this, but I don't.
No,
So,
it's going to be $45 billion more that we're
oh,
spending,
more,
that
45
patients are
billion
spending.
more.
So now that we're not getting fluoride, now we
I
need to
follow
get
you.
more
Wow.
fillings and root canals and crowns. So, I mean, that is huge, you know? And it's
Well,
just,
there are obviously some other options to, recalcify or harden enamel now that we maybe didn't have years ago as well. I don't know if you're able to implement any of those. Um,
yeah.
I
And
know.
so, right. And fluoride is used in other products as well, that helps arrest and reverse oral disease. And it's just like,
Huh,
again, it's my vision of the future was that this is going to be more minimally invasive dental care, more preventive care. But now the fluoride's getting taken away. You question, geez, is it going to be more surgical like we've been doing? Is a shift
yeah.
really going to happen? Are we going to take a step backwards?
Preventative and
And
arrest the continued disease or damage of teeth, and now you're having to figure out. Now I do love to see what's happening in dentistry in a lot of cases where it's more of a wellness centric approach, right? Nutrition,
yeah,
lifestyle, and incorporating that into some practices. That's a little difficult to do in endo, but in general practice. But no, I think that's the reason I asked the question, because I know that especially with kids, and then Medicaid, you do everything you can to get them in the best possible case with Medicaid and Medicaid reimbursement until that next time you can potentially see them, right? So
sure.
I love the fact that you're treating them because of the continuity of care in schools that many times they wouldn't get if you weren't going to the schools in some cases. Now,
Yep.
so I absolutely love that, and I am really really glad to hear that and that it works. I'm kind of curious on the endo side of things. Obviously, you have 4 practices. Did you know from the get go when you opened one location that you were going to go multi office, or what was that transition?
So funny thing, when I came out of my residency back in 2005, I joined actually one of my father's friends who was an endodontist, and he already had 3 locations. And we had 3 locations for a number of years. And then I brought up, hey, maybe we should open, this fourth practice in another location where it was a huge need for endo. There weren't many endodontists in the area, and that has been like our best practice now so far, in terms of the services that we provide. And we consider at times opening up a fifth office, but it just has to be the right conditions. I have 2 partners. Soon we'll be adding another partner as well, so there'll be 4 of us, and it's 4 different heads in a room and 4 different thoughts and perspectives, and we're all kind of different in how we look at those things, and just how
Interesting.
things have been challenging lately with the industry and business and inflation. It's not like we're very aggressive right now in opening a fifth office or location, but we keep our eyes open.
Okay. No, that's good to know. Are you just curious because so many groups, there's different arrangements. Are you having your doctors buy in or have equity in your each of your practices then
Yeah, so it's just
for retention?
considered one, right, under an umbrella.
Oh, okay.
And
Okay.
so
All
right
four.
now there's 3 of us partners, and yes, so we all have equity, and again we'll have a fourth buying in pretty soon here, I think.
Okay. No,
Yeah.
interesting. I ask that because I'm very familiar. I talk to a number of different multi-offs, owners as well as
Okay.
groups,
Sure.
and if you've, well, even in the group space it applies, but the whole old adage of if you've seen one DSO, you've seen one DSO, right? One group, you've seen one group. There's the intricacies make them very different, right? In the
Yeah.
ownership structure, the comp structure, and everything else. So, yeah, I'm always curious. I was an operator for decades, 2.5 decades in dentistry. So I'm very in tune with multi location operations. And so it's
So
just,
I have to ask, Gabe, how did you get into it? Because I
sure.
don't think we got into this before.
Yeah. I guess I haven't shared that with you. I know I have on my podcast, but, so my career started out of college. I did my internship in college in well, at that time, it was the largest multi-specialty physician clinic with
wow.
Wellburn Health Plans, Wellburn HMO, and they also had an HMO, and it was 101 doctor multi-specialty physician clinic. And so I did my college internship there, and I thought I was going to go the medical administration route. Well, around that time, my mother was the event coordinator in Evansville, Indiana, where Heartland Dental Care was hosting their annual boot camp, and I got familiar with at that time. What is a DSO? What is this large group practice? Because they were growing at astronomical rates. And so over the period of
And
about a
about
year,
what year was this about, Gabe? Sorry to interrupt. What
they had
year?
there was about 120 practices at that time. So that would have been
What year?
2003,
Okay.
about 2004, maybe
Wow.
2005.
Okay. Wow. Back in the
Yeah.
day. Okay.
Yeah. Um, and so when I when I started learning about it, I had never heard of a dental group practice, large group practice, or growing at that rate, as well as the training and the support structure and everything else. It was foreign to me because I only knew private practice growing up and what it had been for so long. And so when they started to expand nationally, being the first for rapid expansion, I was interested in like, what is this business? I started learning about it. And so over some time, I was fortunate to get an interview, a couple interviews, get a position in the Indianapolis area as a practice administrator. I learned a lot, and they have a massive, very in-depth training program, or they did at that point. I assume they still do, but leadership, essentially a master's in dentistry, just learning the business of dentistry. And so I learned a lot, and I was learning still to this day. I'm a seeker. I love learning everything I can. But at that point, right, wet behind the ears, I was trying to learn everything about practice operations I could. And so I learned the business of dentistry and continued to, really, I guess, learn the ropes in from clinical operations to front desk operations in the business of dentistry at Heartland. And then I worked with a company out of Kansas City, Missouri for a short period of time. And then I went to Aspen Dental Management for about 6.5 years. I was there. So
Wow.
I learned, Heartland was acquisitions. Aspen was branded practices with removable labs in each practice. So I learned branded de novo model with the lab aspect. And then I was a partner in starting a group in the greater Philadelphia area with partners in private equity. And I did that for about 5 years. I had written a business plan to start one near home. A friend of mine knew that I had created this business plan. Some individuals that reached out to her were looking for someone to start a group in the Philly area. I don't know if I ever told you this, Mark, but I grew up as a kid. I lived in South Jersey in the Cherry Hill area as a
Oh,
kid.
wow.
So I
Jeez.
was spending a lot of time in Philly, but I had not been back until I started my group there. And so we had six, somewhat multi-specialty. Four of them were
Okay.
multi-specialty locations in the Philly area with an administrative center. And I did that for, until I traded in my ownership chips to come back home. I was flying back and forth between the Midwest and the East Coast for about 5 years. And
Wow.
then my wife and I learned we were having our youngest. And so I came home and I worked for a national equipment distributor called Dental TI, and was focused on equipment distribution, largely on the imaging side for about six or so years, maybe 6.5 years. And then a couple years ago, I had been coaching since back in 2014. Just on the personal side, helping some practices on an occasional basis, but operations was still a passion for me. It always has been. Definitely the efficiency of operations. Like, how can you do this, streamlining, simplifying, and making it as simple as possible? Because wearing all the hats in operations, I learned how difficult the business can be and how important developing people is for the culture of the business. And the culture is what sustains the growth in the long term.
Amen to
And
that, Gabe. Amen. I hear you on that.
and so, fast forward, as a consultant, and the podcast was a way for me to meet with people and just continue exploring things that people are doing to optimize efficiency in practice operations. In largely in group practice, but also in large single practices, or even applying to the single location. Because what I learned, that even single locations, with the focus on optimizing efficiency, can reduce costs. And for me, if efficiency isn't just time, isn't just quality. Time, to me, is the most important, because you can reallocate time to productivity. But you can also reduce costs. And for every dollar you reduce in the variable expense or fixed expense line, goes directly to the bottom line. Whereas if you produce more, you have to reduce your expenses. It's not going to be dollar to dollar to the bottom line. So if you're wanting to drive profit, that's the easiest way to immediately drive profit, is to cut costs, be it overhead, negotiate with your manufacturers, create a formulary, whatever the case may be. Right. So I continue learning so much from so many people in the industry, and that's why I do what I do. But I appreciate the question. Back to you and your practice operations. So let's talk a little bit about what you've learned. Now you're 4 locations at this point from when you began in practice operations. I know costs have increased in recent years, but can you talk a little bit about how you counteract that in your
Yeah,
group?
it's so funny, right? In dental school, we get really no business education. We don't know anything about business. When I came out of dental school, my residency, and put into the endo offices and put into the portable dental practice, you hear of a P&L. What's P&L? What the heck is that? A profit and loss. Well, what is that? And the first time you see it, looking at all these numbers, and you're like, what is this? What is that? So certainly, right? I mean, 100%, big time learning curve. For me, it's always been about having the good mentors and, asking the right questions.
So key.
And, some things come easier than others. Some things are more challenging to understand, and it takes time. But, when I look back as to, 20 years ago when I first started, I mean, my business sense is, multiplied at 10 times, right?
Of
I
course.
hope.
Yeah.
But, yeah. And so all the little lessons that you learn over time, and sometimes we have to learn it by doing it the wrong way first, right?
Yeah. I Mark, a couple questions that I always like to ask. What would you say is the lowest point as an entrepreneur in your business, and what would you say is the highest point
Oh,
in time
jeez.
throughout this journey?
Well, I got to tell you something about me. I don't like to acknowledge low points. I kind of just move on past that.
But we learn
And
from those, right? The best learning
we,
comes in
we
those
do, we
challenging
do. But
times.
you know what? Honestly, right? I mean, there's been so many. I mean, how can you?
Okay.
I can't even. It's tough to recall. There's been so many, and there's been so many high points. It's really tough to answer that.
Okay.
And I
A
feel
better
like,
question. A turning point, right? Can you think of a turning point where you're like, okay, things started to come together, or you noticed a change in either the way that you ran the practice, or the way that you worked with your teams, or the
yeah, you
way
know what?
that
I'm going to
you
say
drove results?
actually, I'm going to give a lot of that to my practice manager, office manager for my endo business, and she's also one of our consultants for my portable practice, and her name is Andrea Dickow, and she is just so smart with operations, so smart with
Awesome.
business, and I probably learned the most from her
Congrats.
over the years. She's been such a great mentor to me and my sidekick, and we've done a lot together over the years with the practices, with consulting. But and I'd probably say maybe that was things changed for me. Maybe like the light kind of turned on maybe 10 years ago or so for me.
Okay.
Yeah.
Okay. So about 5 years,
Yeah.
you said 15 years, right?
So 10 years ago for me. So yeah,
Okay. All right.
2015 or somewhere in there.
So
Things
smooth
started to
sailing
click.
now.
Yeah. Yeah. Things started to click and make sense. But, a lot of inefficiencies on the way there. But, as an associate endodontist, I was just so focused on trying to provide the best quality of care to my patients. Business wasn't a big deal to me. It wasn't at the forefront of my mind. And also, as an associate, I wasn't an owner. And so I left that up to the owner and, the program manager. I was just really all about the business and the clinical care and the quality of care that I delivered.
Great.
And it wasn't until later that I started to look at the financial piece and appreciate the financial piece and how I can be more efficient and how it's important to be more efficient. So,
Yeah, that's awesome. I was talking to a client of mine today, and I was having to. One thing that I have learned through to this point in my career, I remind myself to not take anything for granted when I'm speaking to someone, right? To ask questions, because many times fundamentals are not the same from practice to practice. So practices we all do it in our business. We get in a rut, we start going a direction, and then we don't realize how far we've gotten from certain base fundamentals that might be optimally efficient. It happens to every business. And so I was talking to a client of mine today, and it was specifically about that. We're going back to the roots of leading patients to yes, and I had to, essentially like case acceptance and what it means, but what is the product in a practice? And I had to explain to them that to me, I say that a happy paying patient who repeats and refers is the product of a practice. If you do a good job, then they'll gladly pay for services.
sure.
They'll be a brand champion. They'll refer other people and they will repeat. And
Yeah.
obviously that's a little bit different in specialty. However, if people are comfortable, especially on an endo, which there's a whole lot of fear and assumptions around, if they have a great experience, they're going to come back. They're going to want to come back
Sure.
to that practice the next time they need one. But on, especially on the general side, and, and helping patients get the care that they need is an extremely important mindset in practice, because when we get too focused on our day to day and what we have to do, and we lose sight of that specifically, it can be a slippery slope in practice, especially on the general side. So anyway, I only say that because I was having that discussion today, and it reminded me that's really getting back to the roots. And with teams and coaching, mindset and buy-in are so key to continued growth and developing leadership at all levels of the organization. So anyway, I thought of that as we were talking about the business side of dentistry and some things that I experience now, because there was a period of time where I would miss many things because I wouldn't ask those fundamental questions that now I don't step over, right? I have to
And
get,
sometimes, but you don't know what to ask, right? You don't know what you don't know. And
of
it's not
course.
until you get exposed to those things. And that's why it's so great, and especially like what you do with consulting and, you learn stuff. You learn, even though, we're at the ages that we're at and we've been doing this for a while, we always still learn new things.
Oh, always,
Yeah, yeah.
always, every
And
day.
it's, yeah. And it's always so interesting to meet people and to hear how they're doing it, because we always tend to think as humans, right, that we're doing it the right way, the best way, and then we get an opportunity to speak to someone and we hear how they're doing, like, oh really, you're doing it that way, and oh geez, maybe I should do that. And so it's
And
just it's good to get out there and get educated.
that's a great point. A mentor of mine, I have a couple or a few, and one of them, is all about collaboration over competition. And so to your prior point, right? When you break down those barriers and you're willing to dive in, many times there can be a lot of great learning and synergies found in what might have previously been perceived as competition. And so I think that's one of those things that has been an evolution for me throughout my journey. There's so many consultants that do so much great work, and I love learning from them. I continue to on a regular basis.
Yeah, Gabe, know what? That's a great point. And I'm glad that things are more towards the collaboration rather than the competition.
Me too.
Because you know what? The competition, man, it takes a lot out of you, you know. And I mean, sometimes it's good for you to get the juices running, the blood going. But collaboration is so much more easier. It's so much more well appreciated or better appreciated. And we tend to see that, yes, like you said, a whole lot more. And especially, I would say, in the DSO world, and when I kind of got introduced to it several years ago, that was one of the biggest things that stepped out to me, was how everyone was so caring for one another, and giving and providing information, and providing networks. I just thought it was pretty cool, and that was kind of new to me when I saw that, and it really grabbed my attention.
I would say probably the coolest, right? The fact that so many people, no matter their position or where they are in the company, are willing to help, to lend advice or be a resource, and I absolutely love that about our industry. Truly,
Yeah.
truly do. I occasionally have the pleasure, I just did last week, of talking to people that want to move into dentistry from either primary healthcare or other industries. And I remember when I was doing that many years ago in the path. And so having the ability to help them on that path is just something that really, lights my fire. And I
See,
really,
there you go. So you're
so
a
much joy in it.
mentor. You're a mentor.
And that just happens by chance. I'm not trying to be, but at the end of the day, if it's going to give them, I can find that path for them. I am so happy to do it anytime, because so many people have done that and continue to do that for me over the
Yes.
years. And
Yes.
it's like meeting you, again, Mark, crazy, but
Yeah. Yeah.
I see you on that podcast. I love what you guys we're putting out there. And then I
Thank you.
recognize you, and you're like, who is this
Yeah.
crazy guy that's walking up to me? But
Hey, I love the crazy ones. That's why I loved you right away, dude.
yeah, yeah, right. It just worked. I'm like, whatever. Worst they can say is like, who's this crazy guy? Get away from me. But anyway, yeah. So tell me, you do one or two other things too, right? I mean, I feel like you were telling me.
So, I had a consulting business that was big in the federally qualified health center space. And unfortunately, I had to dissolve that recently. And I had to dissolve it because being in the space that we were in, and with the new presidential administration, there were a lot of cuts in the healthcare industry. A lot of grant funding wasn't getting used. And so, we were kind of at a point where there wasn't a whole lot of business for us. And, sometimes you have to make that hard decision. And so, for me, I made that hard decision of dissolving that business. But, me as the optimist I am, I'm always looking to do other things, and I'm working on a couple other ventures right now, which I'm pretty excited about. And hopefully we'll be rolling out within the year. So, all
Awesome.
good. Just always looking for opportunities. How do we make dentistry better? How do we provide care? How do we address the issues of access to care? How do we make things safer? How do we protect our patients? Those are the things that kind of float through my mind on the
Oh, I
daily.
love it. I love it. I was actually, I was looking for a friend. I had a friend call me today that was looking for a wellness centric, not necessarily holistic, but total wellness focused dental practice for her family, and for good reason, which I can't necessarily share, but just a reason why she was looking for that. And she's in Austin, Texas, and I didn't know anybody, so I put it out to the channels that I can, and you know, I love that aspect, that trend in dentistry, connecting the mouth to the rest of the body that many people are doing right
100%.
now. From nutrition to lifestyle to everything else. On the speaking circuit at these shows, these conferences, there's more and more people that are again doing that, talking about great products that may not just be orally, they may be more systemic in how they're treating the mouth to the rest of the body. So the nutraceutical route and everything else the microbiome, right, in the gut, and the role that it plays in oral health and everything else, that I really like that direction. And I know there's a lot of work to still do in it, but you can see the trends in the business. And then, I sleep dentistry has a special place in my heart because, I've known so many people that have sleep apnea over the years, and then selling the equipment that I did, I supported many of the sleep apnea training providers, right? The people that are training doctors to be able to implement sleep apnea. So that's also, right, it's saving lives. And to me, the trend in the business, if there's the ability to improve care that really raises the bar on quality of life or quality of care, right? It's a win-win all around. But anyway, just went on a little tangent there. So tell
No,
me,
no. Hey, listen, that's a
what are
great tangent, and very important because, honestly, so many studies, so much science out there to support that. I've probably read every single one of those studies, but you
awesome?
can't deny that there's a strong link between the mouth and the body.
Of course.
And you just hit a lot of salient points there, Gabe. And we also, it kind of brings us to medical dental integration. A whole nother
Oh
topic,
yeah.
and what's
Yeah,
happening with
that's
that.
exciting too.
Certainly, we're seeing that. We're seeing that with some DSOs. One in particular that's kind of leading the way, and we've seen it for many years in the federally qualified health centers. Integration of medicine in dentistry, and geez, I was just on a call earlier today, and it was talked about and how it's being used or utilized, and that's the direction that we need to go in dentistry. So
Integrated dental into medical facilities or combination
yeah,
facilities, right?
so really, what it is it's coaching, it's mentoring medical staff, so physicians or nurses, on how to screen for decay, apply fluoride, make referrals to local dentists, and of course, vice versa in the dental field. It's about things like measuring HbA1c on patients and providing vaccinations, and knowing signs to look for disease and being able to refer right away to a physician. But listen, I mean, things right now are slow. We know that. We need more physicians. We need more PCPs. Just things are tough. I think we have the vision. We know what it's supposed to look like, what success is supposed to look like, but knowing and achieving are two different things. But, as long as we continue to get educated about it, as long as that word gets out there, people grab onto that, they hold on to that. The public is better educated about it. So as long as that messaging keeps going out, I think at some point in time, we'll see better integration of those two, and hopefully healthier people.
Well, it's awesome to learn that you are involved in that, because I didn't know prior to our discussion tonight. So keep doing that, keep beating that drum, because it will, right. It takes all of us to make that difference. I like to say, on the show that 1% better every day, because those small changes lead to big results in time.
Mm.
Right.
Love
And,
it.
and I mean that. I see that, whether that's life or that's practice. And, the reason that I talk about total wellness, Mark, I, as a, as an entrepreneur, I realize how important our energy and our health and our, to just continue being our best self at home and in the office. Health is wealth. It's we got to have it. And so, starting with the mouth and connecting it to the rest of the body is an amazing way to do that. So, anyway, so
Well
good
said.
talking to you. You're going to be at Dykema this year, right? The
Sure
number
am.
one group
I
conference.
can't
Okay.
wait. Yeah,
I'm looking
I
forward to
can't
seeing
wait.
you there.
That's going to
Awesome.
be awesome.
Yeah. For all the listeners, that are interested in group practice or in group practice, you definitely need to go to Dykema if you haven't. It is the premier group show. There's so many great things at Dykema this year. And both of us will see you there if you're coming. Anyway, thank you, Mark. How can people get a hold of you if they are interested in connecting? What is the best way to connect with you
Yeah,
if they want
thanks.
to learn more about anything we talked about?
Yeah, so a great way to connect with me is through LinkedIn. You can find me probably pretty easily there, or you could email me at mark.e.doherty@cmohs.us.
Awesome. And your last name is Doherty,
You
correct?
got it. Thanks, Gabe.
Awesome.
Oh, and
Great
Gabe,
talking to
before
you always. Oh, go
thanks.
ahead.
One thing though, so speaking of podcasts and all that, and in Dykema and how great an experience it is. With you, your podcast, weren't you nominated for some type of award recently?
Yeah. So thank you. It's not actually Dykema, but at the
Right.
dental.
I know, but you just, yeah, it
Yeah,
was all kind
yeah.
of thrown in there.
This podcast, the Dental Efficiency Playbook. Again, for all the listeners, please don't forget to. It'd be an honor if you would hit the button and subscribe. And follow it so that more and more of these episodes can come out. Truly, my purpose in doing this is to serve in any way that I can and connect with great people like yourself, Mark, and really share insights, again, insight, tips, tricks, and the occasional cheat code, like something that's going to help you to level up dentistry. I know it sounds like just an intro or an outro. It's not truly, there aren't too many cheat codes in this industry, but when it comes to efficiency, there's still a few of them that you can tap into that are game changers. And every once in a while on the show, we share one of those or talk about one of those. Otherwise, I think it's sometimes fundamentally good stuff, and other times it's a little bit deeper of a dive. We talked about quite a few different things tonight, and I truly thank you for joining me tonight. I for those of you that would like to, you can on the Dental Festival socials, you will find podcast of the year, podcast host of the year, and the Dental Efficiency Playbook is listed as one of those podcasts. I would be more than honored if you're willing. Again, if you feel that it's right to vote for the show, I would be grateful. Again, if you're not feeling it and you don't feel like it's a fit for you, that's okay too.
Where and when
I
is that, Gabe?
I appreciate you listening. It is actually towards the end of August. I believe it's the
Oh,
23rd, 4th, 5th, maybe 22nd through the 24th, something like
where?
that.
Where?
In Delray Beach, Florida.
Oh, nice. Awesome.
Yeah,
Good luck. Good
it's going to
luck.
be a good show this year. So,
Cool.
lots of great stuff going on. There's the dental socials. There's the speaking circuit. So there's always new speakers on there with really fresh new topics as opposed to the traditional ones that you see many places. There's a formal night. There's just some really fun stuff as well. So if you can make it to that show, the dental festival, and if you're interested in a discount ticket, you can always reach out to me, and I have a discount code for you. So shameless plug there for a show that I'm going to be at, and would look forward to having all of you there. So, but Dykema's next on the show circuit, and I look forward to seeing you there, Mark, and
Thanks,
anybody
Gabe.
else that will make it. Again, thank you for joining the Dental
Thanks
Efficiency
for having
Playbook.
me.
Absolutely. And don't forget to hit that like button and subscribe to the show. And we'll see you on the next episode.
See ya.
Hey, friends. Before you head out, I just want to say thank you. Seriously, there are a lot of places you can spend your time. And the fact that you're here with us, investing in getting better, building smarter systems, and elevating your practice, that matters to us. If today's episode brought you value, please do us a quick favor and like and subscribe, and share it with someone on your team who's ready to level up alongside you. That's how we keep raising the bar, that standard across dentistry, together. And if you're ready to take what you learned and actually implement it in your practice, head down to the show notes and connect with us through the link below. We'd love to help you streamline, grow, and create a practice that runs with greater efficiency and a whole lot more ease. Until then, keep focused on 1% better each day and enjoy the ride. We'll catch you on the next episode of the Dental Efficiency Playbook.